Specialty Stories, session number 93. Whether you're a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you'll want to practice. This podcast will tell you the stories of specialists from every field to give you the information to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome to Specialty Stories. My name is Dr. Ryan Gray, and I'm excited to bring you another specialist here on Specialty Stories. This week, we have Dr. Nick Potisek, a pediatric hospitalist. We dive into why pediatrics, why hospitalist medicine, and what that life looks like for Dr. Potisek. If you are interested in pediatrics, take a listen. If you are interested in hospitalist medicine, take a listen and learn. We start with how Dr. Potisek became interested in pediatric hospitalist medicine to begin with.
Starting medical school, I had always had an interest in kids, and a lot of my life I had done activities that worked with children, whether it was a YMCA summer camp or youth ministry, or even just basketball camps. And so I knew I really enjoyed being around kids. I wasn't certain I would enjoy the medicine or medical aspect of working with kids. And so I was a bit hesitant to commit to that entirely, but I knew that I enjoyed being around kids. And then as I immersed myself into the third year, where that was the clinical years of medicine for us at our school, there were a lot of things I really loved about pediatrics. And ultimately, by the end of that year, I was between medicine and pediatrics as far as, and when I say medicine, internal medicine and pediatrics. And ultimately, there were just several things that just drew me to pediatrics over internal medicine at that time.
What do you think it was that drove you that way?
Yeah, so I really liked the resiliency of kids. You just didn't see many kids pass away. However, I will say after doing residency training, and even now when that does occur, it is very devastating, as it's oftentimes unexpected, or maybe it's just a child with a significant illness. And so I liked how resilient they were. My dad used to say that maturity was overrated, and I've never taken myself too seriously, and I just enjoy incorporating humor into my interactions with patients. And I found like I could readily do that with kids. Were some of the big things that drew me towards working with them. Probably the other thing I really loved as well was just the incorporation of families too. I felt like not only were you taking care of the child, but you were taking care of the parents and extended family members as well.
That seems to potentially drive away some potential future pediatricians. They're like, I love the kids, but dealing with the parents is just something I don't want to deal with. How do you handle that?
Well, when I even decided to go into medical school in the first place back in the day, my dad was very sick, and I kind of saw how the communication a physician has with a loved one not only makes a difference for that individual, but it does for the entire family as well. I had opportunities to see physicians communicate really well with my dad and family, and that was having no medical knowledge at that time. I saw individuals communicate poorly. And in many ways, I wanted to be one of those individuals that communicated well. And so I was attracted to that. I think you're exactly right. I think that sometimes the nervousness or what people think are lots of worries, et cetera, from families may be a turnoff to them when choosing a career. But that was something that I looked forward to even before making that decision. But I think you're exactly right.
What traits do you think lead to someone being a good pediatric hospitalist?
Gosh, so I'd say there's lots of different qualities that contribute to a good pediatric hospitalist. when you think about pediatric hospitals, there are two real flavors. There's ones that work in an academic setting and in a community hospital that may or may not have learners. And then some community settings do have learners. And so oftentimes you do have to really work well in a team, just because you may have learners with you, whether that's residents, students. You often have your additional support as well, respiratory therapy, pharmacy, physical therapy, occupational therapy, et cetera. And that's not separate from other inpatient fields, I'm sure. Other things that typically serve hospitalists well is being able to work well with your colleagues, just because it's not uncommon that you'll need specialty help depending upon the case. You need to be able to communicate well, not only with your various team members, but also with families as well. And I think teaching as well, teaching not only for learners, but for patients and families as well, so they can understand what is going on. But I don't think those are necessarily unique to pediatric hospitalist medicine.
Now, the whole hospitalist field is still relatively new in the grand scheme of things. What do you think it was about the hospitalist position that drew you to that world versus being an outpatient pediatrician?
Right. Hospitalist movement, even though it's been around for a while, the whole accreditation process is pretty new. The first board test will actually be this fall. And so it's that new. And you're seeing more and more that pediatric residents are now pursuing fellowships. And in fact, the fellowships cannot keep up with the number of people that are interested in pediatric hospitalist medicine. And I completely distracted myself from, what drew me to this instead of outpatient pediatrics. I liked the acuity of care a good bit more. I liked dealing with what I perceived to be sicker children. I also like some of the medical mysteries I deal with, but that can also be dealt with to an extent on the outpatient setting. And I like kind of working with numerous subspecialists and trying to figure out a problem. And so those are probably the two big things: the acuity of care and the complexity of disease that I encounter.
Let's talk about some of that disease. What are you seeing day in, day out as common things in the hospital?
Yeah, so there's a lot of seasonal variation in pediatrics. And so kind of around the fall to winter, it's a lot of respiratory conditions. So bronchiolitis would be the heavy hitter, not only that I see, but my colleagues see around the country. Pneumonia, whether that's viral or bacterial, and then asthma exacerbations too, tend to be some of the typical respiratory illnesses that come in and are more seasonal dependent. A lot of common things would be neonates, so specifically infants that are 30 days or less that have a fever that get evaluated for any kind of bacterial illness. And then everything else, it would be sometimes skin and soft tissue or bone infections would not be uncommon. And then we're taking care of more and more medically complex children who are in many ways technology dependent, meaning they may have a tracheostomy, they may be neurologically devastated, they may have a gastrostomy tube, they may require a home ventilator as well. And so those are probably things that I can often anticipate seeing when I'm on service.
Describe a typical week for you.
Yeah, so a typical week for me, well, I've learned that there is no typical week for me. So I'll preface it a little bit, is that half of my time is actually geared towards pediatric hospitalist medicine, and the other half is actually dedicated towards teaching. And that's primarily medical students, but it's also residents as well. And so I typically work about 7 days in a row, Monday through Sunday. When I work Monday through Friday, I typically start at 7 a.m. and I typically get done about 5:30 to 6 on a late day. And then one of my colleagues usually takes over at night. And then on the weekends, I usually just work kind of the same hours in the hospital, and then I just take call from home on new admissions. And so what that means also then is that sometimes I do work at night as well, but that's not the majority of what I do. It's probably about 2 to 3 weeks of the year. And then when I'm not on service, taking care of patients, I'm usually doing stuff with curriculum development and other kind of teaching activities. And so there's a good bit of variability from what I do and what colleagues around the country are doing.
As a pediatric hospitalist, do you have the ability to do a lot of procedures?
You actually do, and some a lot more than I do. And so what I find is that a lot of procedures are already done in the emergency department. If they aren't, then typically the ones that I would be able to do would be like a lumbar puncture, would be like one of the main ones. There's friends across the country who are trained in sedation, and so they can actually incorporate sedation into their practice, whether it's a patient going for a head MRI or some other kind of MRI and they're pretty anxious, or other procedures as well. Aside from that, a lot of the other procedures are smaller than that, and I don't think people that do a lot of procedures in the OR would be terribly excited about them.
What does the training path look like to become a pediatric hospitalist?
Yeah, so after completion of medical school, you do a pediatric residency, which is about 3 years. And now we're encouraging people to pursue fellowship, and that's typically 2 to 3 years. There's still a lot of variability kind of within those fellowships. Some offer additional master's training, et cetera. Some are more research focused, some are not. And so there's a good bit of variability there. We're still trying to understand that across the field. So you're looking at, from completion of medical school, about 5 years total.
It's interesting because the majority of pediatric residencies that I know of are the majority hospital based. And so it's like that is your hospitalist training. I'm wondering how useful extra training would be, or if it's just part of the process.
Yeah. I think that's a wonderful question. And I suspect there'd be a good bit of debate about that across the country as well. And I think you do see there's a good bit of variability across the country as far as who gets trained more in inpatient medicine versus outpatient medicine. And I will say for my training, I trained at UNC Chapel Hill for medical school residency, and subsequently was a junior faculty there. But I was more inpatient heavy as well. So I would agree with that. However, I have friends who are more outpatient predominant. And even where I work now, I would say they at Wake Forest or probably have more of an outpatient feel than inpatient.
So with the new fellowship that's being created and the training and the board exams and stuff, is it going to be required at this point for somebody who's interested in being a pediatric hospitalist to go through all that training, or can you be grandfathered in, or is there a window period where you don't have to do that?
Right. So right now people are being grandfathered in, and because of how many pediatric hospitalist positions there are and the lack of fellowships, that is still an opportunity. And so people typically have to have a certain amount of hours kind of leading into the board exam, and then obviously they have to pass the board exam kind of to that. And this would be similar to what pediatric emergency medicine, I think, experienced as well. But what we'll see is that they will ultimately require a fellowship once those numbers kind of catch up. But we're still a good bit of ways away from that.
Yeah. Do you see any opportunities once somebody is trained as a pediatric hospitalist for them to further subspecialize into something that may interest them?
Oh, yeah, I think so. I mean, some people are very much a glutton for punishment. And so, one of my friends is doing infectious disease training, and he is doing a pediatric intensive care unit fellowship as well. And so I think that if people found something that they really want to kind of narrow down their interest with, whether it's infectious disease or maybe they wanted to incorporate some additional anesthesia, et cetera, they could. That's kind of one of the great things about medicine. It's also, I think, one of the hard things is just that training really takes a little bit more as well. So kind of from those aspects, yes. Additionally, I think I said it earlier as well, for people who are interested in education or other aspects of medicine as well. You're finding that a lot of fellowships are allowing opportunities kind of for that as well. So for individuals to really kind of get that backing of education too.
Do you see any negative bias towards DOs in the field?
No, I don't. Primarily, where I am at Wake Forest, we have several residents who are DO trained. And so I haven't seen that. We don't have a fellowship program, and so I can't speak to that entirely. But I don't believe so.
Yeah. What do you wish? This is an interesting question because as a pediatric hospitalist, you're kind of primary care, but more acute because you're in the hospital. But what do you wish the pediatricians that are out in the community, sitting in their offices, what do you wish that they knew about your job in the hospital to hopefully maybe get patients to you sooner, to see you sooner, to get care?
Yeah, that's a tricky question. I don't know if there's as many. I'm sure they probably have many things that they wish that I would do for them. I think just how accessible kind of myself or other colleagues are as well, that if they have questions, concerns, coordination of events and everything like that, we're usually pretty happy to do that. And so I think just reaching out and kind of seeing how we can help and serve like earlier is helpful. And I'm sure some areas, regions have that better well established.
Are there any special opportunities outside of clinical medicine do you see for pediatric hospitalists?
Yeah, I mean, you kind of find, again, there's a good bit of variability into what a pediatric hospitalist is. And so some people only work at night, and so they're called nocturnists. Some people kind of do like a hybrid model, kind of like I described, kind of the daytime and then nights as well. Some people incorporate a swing shift, which is usually a shift in the late afternoon, kind of during their busiest time of patient care and admissions. But then on top of that, you're also seeing a lot of people work in the newborn nursery, and that's considered a hospitalist position as well. Some people kind of blend that along with the descriptions that I kind of described. Or incorporated, and then some people only do that. And then some people are creating follow-up clinics as well, meaning that they will see patients that have recently been discharged from the hospital, seeing how they saw the patient when they were not looking so great, instead of their regular physician seeing them. And so you are seeing some people trying to create outpatient opportunities based off of the patients that they cared for inside the hospital as well.
What do you know now that you wish you knew before going into pediatric hospitalist specialty?
I wish I would have done a little bit more with quality improvement. That was something that is incorporated in residency programs now, and I think a lot of them are trying to really kind of bolster that effort. But I wish that I would have done a little bit more with that, because I think that it's important to really any field, specifically with hospitalist medicine, as you're just trying to promote change to improve patient care or other processes. I find it a really useful skill to have. And so that's one that is kind of on my to-do list to gain further experience with.
Yeah,
it's something that we're required to do kind of for our maintenance of certification as all pediatricians. However, it's one of those skills that I do think is pretty helpful in the hospital setting.
Yeah, it's interesting you mentioned that. I don't know when this episode is going live, but on my pre-med years podcast, I'm going to have a guest on either before this comes out or after this comes out, who she runs a master's program that's engineering based, but it's all around process improvement and really breaking down systems and looking at where issues are, because it's something that physicians need very, very much so.
I think so as well. So, I think in the hospitalist environment, so many environments that applies to. And so I don't think it's necessarily just pediatric hospitals, but I do find it a fascinating area and one that would be helpful in many situations.
Yeah. Got to break out the Toyota system books and learn all that Six Sigma and lean and all that fun stuff.
Yeah. I mean, you just see some fields, some industries have it down really well.
Yep. Very cool. What do you like the most about being a pediatric hospitalist?
I enjoy most working with learners. And again, I think that can be done in a variety of settings, but I love kind of working with a team of students and residents and pharmacists and nursing staff. And I love opportunities to teach. I love opportunities to see people grow as clinicians and other providers. I really enjoy still getting a diagnosis right, regardless of how big or small it is. And I love trying to impart knowledge, questioning why we do the things that we do, and how to get better about that as well.
What do you like the least?
Probably, I think one of the hardest parts is sometimes you don't necessarily think that a child needs to be hospitalized all the time, but at the same time, I find that I respect my emergency department colleagues and trust that, when they saw the child initially, that the child was not well off. And so sometimes I don't necessarily think the kid needs to be hospitalized, but that seed has already been planted kind of for them. And so I don't love that, but at the end of the day, if it brings a peace of mind to the family, if it kind of honors the initial decision-making of one of my colleagues, then I'm comfortable with doing it. But sometimes it feels a little unnecessary.
Do you see any major changes coming to the field outside of boards and all that fun stuff that maybe a medical student or resident should be thinking of?
Gosh, no, not now. I mean, that's by far the biggest thing that everybody is talking about. And so it'll be interesting to see kind of as more fellowships start popping up, kind of how they develop the curriculum even more to standardize the training that learners are getting.
If you had to do it all over again, would you still be a pediatric hospitalist?
Oh, yeah. I love what I do.
As we finish up here, what last words of wisdom do you have for a medical student or pre-med or even a pediatric resident thinking about this? What do you have to say to them?
Well, I think whatever that learner is doing or thinking about, I think the main thing is to remember why they decided to go into medicine in the first place, what they loved about it, and where can they maximize the things that they love. Is it being a pediatric hospitalist like it is for me, or is it somewhere else? Because I think that on your best days, on your days that aren't so great, it makes all the difference. When you kind of make a decision like that, when it's something that you're excited about, when it's something that you can just remember, like the joy and the love that you have about the things that you do. It's a challenge sometimes to always keep that at the forefront of our minds, and I don't do that either. But I try to, and I think that when working with learners, et cetera, it allows me the opportunity to try to inspire that generation. So I guess I'm being overly wordy, but follow your heart and what you're most passionate about, because at the end of the day, that will serve you best.
All right, so there you have it. Again, Dr. Nick Potisek, a pediatric hospitalist, sharing his journey and what pediatric hospitalist medicine looks like so that you have a good idea of what may be out there for you. Next week, we have a great guest, a reproductive psychiatrist, something that I didn't know existed until I talked to her. I hope you have a great week. We'll see you next time here on Specialty Stories.